Hey, you're listening to the Conservation Cooperative, a production of the New England and New York chapters of Backcountry Hunters and Anglers. I'm Chris, and it is my pleasure to guide you through part 2 of our look at chronic wasting disease preparedness in the region. If you haven't listened to part 1, I would be remiss if I didn't encourage you to go back and listen. We take a minute or two to set a benchmark of understanding on CWD, talk to one of the nation's experts on the disease, and hear how the New England chapter drew a line in the sand to protect the wild deer herd in southern New England. In part 2, we are going to hear from leading experts on how a number of different states, New York, Vermont, Rhode Island, Maine, and Massachusetts to be precise, are positioning the state wildlife agencies to be prepared for chronic wasting disease. We'll start with New York because they're the only one of the aforementioned states that has had to respond to the presence of CWD. If you recall from the last episode, in 2005, New York detected the presence of CWD in a captive cervid facility and learned that it had spread to wild deer in the immediate vicinity. They responded extremely aggressively, putting a tremendous amount of resources into action. It worked, and for nearly 2 decades, and after tens of thousands of tests, there wasn't a positive case until this past October when a deer tested positive in another captive deer facility in Herkimer County. Fortunately, there has been no confirmed cases in wild deer, and the state is responding aggressively again, depopulating the captive deer facility and culling deer in the surrounding area.
Any person working on CWD these days would say, do as much as you can as early as you can. Hit it as hard, because taking that sort of laid back, let's see, it's not that big of a deal approach has not worked.
That's Krysten Schuler again, director of the Cornell Wildlife Health Lab, discussing the need for an aggressive response plan.
Some of the modeling is showing that if the prevalence gets above 1.5%, that there's really not any management actions you can take. So you really need to work hard when it's at a low level. And unfortunately, that means decreasing the local deer density to stop transmission. And unfortunately, hunters hear that as, you're killing all the deer. Hunting's going to be terrible forever. You shouldn't be doing this. And really, it's a very almost, surgical precision what we have with some of these models now. Like, this is the area that infected deer likely used. We're not going to go out beyond a certain mile radius. And we just need to decrease the density there to stop the transmission, to stop deer from shedding prions into the environment. Because once the number of diseased deer contacting each other spreads disease, but then they're also shedding prions and their feces, their saliva, and their urine, and that contaminates the environment. So after the course of time, you don't even need that deer-to-deer transmission once the environment gets contaminated, and then you can't really do anything about it. So I think with sportsmen and women, trying to make sure they understand, like, yes, this may stink for you, for your hunting opportunities for 2 or 3 years. If we come in year 1 and 2 and really try to decrease the density, it may be awful, but the goal is to get that density down to stop transmission.
If CWD is to be stopped after being introduced to an area, it will come at a cost, not just in terms of financial resources, but also the opportunities available to hunters. Still, the cost of doing nothing comes at an even higher price tag. Given the fact that New England states haven't detected CWD, how does a plan to surveil and potentially respond to CWD even come together? Well, the best practices behind those efforts are largely tied to the work that Dr. Schuler, her colleagues, and the New York Department of Environmental Conservation have done.
So for New York, we developed what we call the hazard model. So it's a risk-weighted surveillance system. So basically, like, where do we think that the prions are going to come into the state and how are they going to be spread? And so we worked through that process with the Department of Agriculture and Markets and Department of Environmental Conservation over the course of the year and said, okay, these are what we think are the different hazards for introduction and spread. How can we look at them on the landscape? And so there was a really intensive field survey And that resulted in sort of a map and a quota system to say, okay, these counties have the highest risk. We need to sample most intensively from those areas. And it's based on what the agency, what their budget is, what their logistics are for personnel being able to go out and collect heads from meat processors and taxidermists, and obviously partnering with those businesses because they're a critical component as well.
Other states began to notice New York's approach and began asking how they could begin implementing similar systems, which has ultimately led to the creation of Cornell's Wildlife Health Lab Surveillance Optimization Project, an effort to standardize and optimize data for wildlife agencies at no cost.
So doing that for New York, then a few other states started asking for a similar system. And after, a few dozen states, we said, well, we should make this into a better system instead of sort of one-offs. And so gathering about a dozen state agencies together, the biologists, veterinarians, administrators to talk about these things, that was when we realized everybody was sort of using terminology that was slightly different, that we couldn't agree on what term should be, and that just that mismatch of like everybody's doing CWD surveillance, but they're all doing it a little bit differently. And especially now in the age of sort of supercomputing and machine learning and things like that, we're not learning as much from each individual data point as we could. And it takes a lot of time, effort, and, money to collect each of these data points. So we want to squeeze as much value out of them as we can. So in a nutshell, what the Surveillance Optimization Project is now is that we've got free software for wildlife agencies, tribal agencies, provincial, to use. And depending on where they're at, some agencies are really advanced. They're using Oracle systems and have everything automated. Some are still, using Excel spreadsheets. So wherever you are on the spectrum, if you need help with data management, the system will do that for you. If you want to run models to figure out where you should be doing more surveillance, where your deer population may be at higher potential for disease introduction, all these different models that we at Cornell have developed, but there's a lot of other models out there. And thinking about your average agency biologist, they don't have time to, go in and run all these. So how can we make them so they run with like a click or two of easily understandable language? So adapting that to be useful with that data. And then letting agencies see what their neighbors are doing, how much surveillance is happening along your border, and do you need to adjust based on what your neighbors are doing, what they're finding, what sort of risks they're willing to take based on regulation. If they ban the import of live captive cervids, if they allow hunters to bring back whole carcasses. So incorporating all those different factors into sort of one system, and then making that data available for other researchers with agency permission. So it's not, then the researcher doesn't have to go to each individual agency and say, can I have this and that, which takes more of the biologist's time. So trying to streamline these processes and into more of a data pipeline so that we can really learn more and look across a broader landscape to try to get some answers to these challenges.
Hopefully you're beginning to appreciate all that goes into the process of being generally ready for CWD. There is a pretty significant gap between state agencies in New England and their overall ability to surveil for the disease, let alone respond if the worst case scenario unfolded. To be clear, this isn't a function of lack of forethought or incompetence, far from it. Rather, it's the fact that these are small agencies with modest funding at best, being pulled in a ton of different directions. Some departments have fully formed surveillance and response plans, while others are just beginning to take shape.
We're in this surveillance phase right now. We've been collecting CWD samples here in Maine since 1999.
Meet Nathan Bieber, the deer specialist for the Maine Department of Inland Fisheries and Wildlife. He oversees the management and research for the state of Maine, a role that he's held for the past 7 years.
We collect about 500 or so samples a year. Most of those are from hunter-killed deer during the regulated hunting seasons, where we'll just go around and We collect a lot of data at places like meat lockers and butchers and stuff like that. But we'll have a list of towns that we view as sort of higher risk towns. And if we encounter a deer that's an adult deer from one of those higher risk towns on our rounds collecting other data, we'll also collect CWD samples from those deer and send them off to a lab. So that accounts for most of the samples we collect in a year.
Over the course of 25 years and close to 14,000 samples, Maine has never detected CWD. According to Bieber, high-risk towns are those that have captive cervid facilities or have unnaturally high concentrations of deer. For instance, in winter months, there are feeding operations that create some very high deer densities, even for natural wintering areas.
Here in Maine, wild deer are overseen by Department of Inland Fisheries and Wildlife from my desk, but the captive cervids are overseen by our Department of Agriculture, Conservation, and Forestry, so they're treated more like livestock and they're not under our jurisdictions. I wouldn't say we have, I think 11 maybe what are called commercial large game shooting areas. They're hunt parks essentially. And then I believe other than that, we have around 20 other facilities that have captive deer, whether that's a breeder, like a big breeder, or just a hobby farm with a couple display animals. So we have about 30 or so facilities in total in Maine that have some number of captive deer. And they're restricted on the types of species they can have. And most importantly here, I guess I would note that we don't allow white-tailed deer in Maine to be held in captivity. So we don't have any captive whitetails. As far as bringing animals into Maine from other states, we essentially don't allow any captive cervids to be brought into Maine from anywhere that has CWD, anywhere that's close to somewhere that has CWD, or from anywhere that allows transport of animals from jurisdictions that have CWD through their borders, which narrows it down to maybe one or two states, if any. So rules are in place essentially in such a way that you can't bring live captive cervids into Maine. It's almost impossible. We do allow them to be exported though, and that occasionally happens. So we send some deer out of the state, and also within the state, deer can be moved between facilities, but we essentially don't really have captive cervids coming into Maine from other places.
Maine was one of the first New England states to draft a CWD response plan, but Bieber acknowledges there are still a number of areas that need to be strengthened. For instance, what to do with the carcasses of deer that test positive.
I think a concern that we have that's probably shared amongst quite a lot of other folks that deal with CWD or are preparing to is disposal of carcasses. We did get recently a mobile incinerator here in Maine for disposing of carcasses that I think it belongs to our department, but as far as capacity goes, you could maybe incinerate a deer at a time, and I don't know how long that would take. Other than that, though, we just don't have good options. So if we're testing a lot of animals, especially if there's positives, for the most part, our landfills aren't going to take them. We don't really have an incinerator facility that can take a large volume of animals, so really limited options. I know some states have even shipped their deer to other places where landfills will take them, other states and things, but yeah, just not a lot of good options. It's going to be hard to get rid of a lot of animals if we need to do that.
Moving from the largest New England state to the smallest.
So my name's Dylan Ferreira. I am a principal wildlife biologist with Rhode Island Division of Fish and Wildlife, and I oversee the white-tailed deer program. So here in Rhode Island, CWD is something we're definitely concerned about, worried about, thinking about kind of all the time. I think we're pretty lucky as a state. We don't have any captive cervid facilities. And being in Rhode Island, we're a really small state. We're bordered only by Mass and Connecticut and the Atlantic Ocean. So we feel like we have a little bit of a buffer zone with Mass and Connecticut as sort of a red flag to be like, if they pop, maybe we should tighten up other things, other regulations, but we're pretty tight as is. We don't allow any importation of deer or carcasses from anywhere except for our neighboring states right now, because a lot of our hunters are coming from, Connecticut and Massachusetts. So our regs are pretty tight. We've been monitoring for CWD for over 20 years through our hunter harvest, road kills with butchers, taxidermists, and we've yet to detect it. So I feel we have a pretty good sampling structure right now. Could it be better? Of course, we can always sample more deer. But I do think we're doing a pretty good job looking for it. And so far, we've been lucky enough not to find it.
According to Ferreira, Rhode Island's CWD response plan is not yet finalized. But what is fleshed out is largely based on New York's plan. He admits there is a glaring difference in the capacity and resources between Rhode Island's Division of Fish and Wildlife and those of New York's DEC.
Do we have the staff and funding and resources to respond like some of these other states? It's definitely going to be challenging. A lot of states have, their headquarters with regional biologists and regional staff. In Rhode Island, it's just one deer biologist and his technicians, right? There's only two of us on the deer program right now. So it would be challenging, but based on or thinking of a lot of other federal grants for CWD response, I think there are resources out there that would kind of cover us.
Leveraging federal grants in building capacity as it relates to wildlife diseases is something that the Massachusetts Division of Fish and Wildlife, also known as Mass Wildlife, is really leaning into. These efforts are being led by Martin Feehan, the state's deer and moose biologist.
In my role, I pretty much handle the entire portfolio of deer issues in Massachusetts. We're pretty unique in that kind of all the aspects of both research, the actual population model and harvest management, also like working with communities, and also even the enforcement and permitting of captive deer facilities is all underneath my position.
Mass Wildlife's work involving CWD has involved everything from active surveillance to human interventions work looking at the public's understanding, concerns, and awareness of the disease. Most recently, the division put together a new rules package that aimed to tighten up the state's regulations in an effort to reduce the chances of the introduction of CWD. This included sunsetting all captive deer facilities and also expanding the deboning requirements to all states outside of New England. But what really sets Mass Wildlife apart is its investments in preparedness. Under Feehan's leadership, the division has secured a number of competitive federal grants that have bolstered every aspect of their ability to monitor and respond, not just to CWD, but other wildlife diseases in the state and region.
One of the challenges we face here in New England is being small states and states that haven't had detections yet. We really don't have the presence of labs that can do the testing. And so that is a concern if there's actually a new detection, being able to implement rapid surveillance and be able to do things like sharpshooting and such that you would need, with then also being able to have fast detection and testing of those samples is currently quite challenged. And one of the things we've done with our current USDA grant is to start to actually establish more regional testing capabilities. We brought our testing to the Animal Health Diagnostic Center at Cornell, so that way we can bring that where it's just one state over, allow much faster testing on that end. We are also working with the pathology lab at the University of New Hampshire to potentially have them in the future set up as a testing site here for just New England, so we can really keep the capabilities here available. But it's a lot of infrastructure to build up, and we certainly our timing was good with all this, where we were doing all this work ahead of time. New York had that first detection in October, and I will say that had it not been for our work over the last couple of years, we probably would have been sort of on our back heel on some of this. But as soon as that happened, we already had the education materials, we already had the communication materials ready to go, and the surveillance was starting to pick up. We just brought surveillance back during the 2023 season. And now in 2024, when we expanded it quite a bit with nearly 400 deer tested, we were able to very effectively communicate how important this is because of New York having those cases within 90 miles of our northwest border. And that really was important. And it's something that I've stressed with USDA as to why it's important that they continue to fund these CWD cooperator grants, particularly for some of the states that haven't had detections. Most of that focus has been on states that have had CWD detected and, on regular surveillance and management of CWD. But for those of us that haven't had detections yet, there's a lot that we can be doing from a prevention standpoint. And we could not have done everything we've done the last few years without those funds from USDA.
In 2023, Mass Wildlife was awarded a 3-year grant from U.S. Fish and Wildlife Service's Zoonotic Disease Initiative for nearly $750,000 to develop a wildlife health and public outreach program for Massachusetts and to research wildlife diseases and prevent their spread within the Northeast region. Again, Grants like this are vital in building the necessary infrastructure for interagency cooperation to take form, so that when disease outbreaks do pop up, like the region's recent bout with avian flu, we are ready and able to respond appropriately. Vermont is our last state check-in. Their approach has primarily been focused on the preventative side of things. They've had a ban on baiting for a while, and they were one of the first states to ban the use of urine-based lures.
Nick Fortin. I am the deer and moose project leader for Vermont Fish and Wildlife, so I oversee pretty much everything to do with management of both deer and moose for the whole state. We have a carcass importation ban like most every state does at this point, so you can't bring a whole deer or certain parts back from any state that has CWD or any facility, regardless of where it is. I would say we're ahead of the game. The beauty of being a small state is we don't always have the resources, but it's easier to push through some of the political rule change stuff. So we've done most of what we can do to prevent CWD here. We do a little bit of surveillance. I'll call it minimal surveillance. Basically, we test any sick deer that shows up, emaciated deer stumbling around someone's backyard. The warden puts that down. We're going to test that for CWD. We're doing maybe 5 of those, but that's the only surveillance we're doing. Again, limited resources in a small state. So that's what we can do. We'd like to do more.
The sentiment of wanting to do more is one I've heard from all the states I've talked to. It's incredibly resource intensive to move from a surveillance mode to a response mode. For a small agency, a lot of resources would need to be immediately shifted around to even have a chance of slowing the spread.
Yeah, I think if CWD shows up, or maybe when CWD shows up in New England, all of the states are going to have to respond, right? It's within walking distance of a deer in every state at that point. So when it shows up in New England, speaking for Vermont, we are going to respond, and what it likely means diverting a lot of resources from other conservation work so that we can address CWD, because it's not just throwing money at it. We need a bunch of staff to oversee all the work that's required, whether that's, culling deer, testing deer, working check stations, getting information out to hunters or taxidermists or processors, all the places we might want to address. It's a massive resource suck once it shows up, if we're going to try to address it. And that is at least our approach right now, is where we're not going to just sit by. We're going to try to eradicating, all science kind of points to that may not be a realistic goal, but we're going to try. And then at the very least, we're going to try to slow it down when it gets here. So yeah, it's going to really change a lot of the work our department does if and when it shows.
According to Fortin, Vermont is currently in the process of developing their response plan. I should point out that the work each state is doing doesn't happen in a vacuum. All of the deer biologists in the region meet annually and are in regular communication with one another. They share information, bounce ideas off the group, and work towards the common goal of protecting our deer herd. Also consistent was the idea that hunters have a critical role to play in this whole effort to combat CWD. Martin Feehan explains.
It's important for hunters just to remember that they play a very important role in this whole piece of managing population disease. State agencies can only do so much when it comes to a lot of this. A lot of this really requires cooperation amongst hunters themselves, coordination and support from hunting organizations. And while some of these things may sometimes feel like they're a burden, that, it's like, why do I really got to follow this? Why? Or if you're in a state that has detections, do I really need to go through all this to drop off a head or drop off samples? And the reality is it's really important. It really is. Like, even though some of these things add just a little extra burden to hunting, we all know how important this sport is to us. And we want to make sure that these deer herds are in as best shape as we can. And sometimes it can feel kind of like a never-ending wave as CWD spreads across the states. But if you look at even the states that have had detections, there's good work being done to help prevent the spread to new areas. And a lot of the states, have areas where they are seeing some of the population impacts. They're seeing reductions in herds. And there are issues in terms of loss of mature bucks, for example, in certain portions. But the more hunters do to follow the recommendations, the more likely we are that we can keep as much of the landscape and as much of the deer herd healthy as possible.
A final commonality among all the deer biologists was a concern for what CWD might do to our connection with deer. Dylan Ferreira summed it up well.
I get really nervous if it comes here in Rhode Island, how that's going to change how hunters view deer. Right now, they're valued not only for the intrinsic value, but people see them and think, okay, this is how I'm going to feed my family for the year, like myself. So when that begins to change and now they've become a disease vector that is transmitting disease across the landscape and potentially has human health implications, which isn't determined yet, yeah, it definitely changes their the perception of deer through the hunters and the public eye. That makes me nervous because I already deal with a lot of the public who don't like deer because they're eating their roses and their abrevieties. But most hunters love deer, right? And so it's great because I have that same, connection with deer that I love to see deer. I want them on the landscape. I value them. And even if they get CWD, I would still value them, right? But it definitely changes the outlook. And it does make me nervous for the long-term trend of hunting, especially in the Northeast, right? This isn't Montana, we have few hunters to begin with. So anything that would jeopardize what hunters are doing and why they're doing it, just another reason not to hunt, is not something Rhode Island needs, especially anywhere across New England and the Northeast.
We hope that you found this look into CWD preparedness in New York and New England interesting. Generally, we're moving in the right direction, but we're all going to have to advocate on behalf of our state agencies to ensure they have the resources to be ready and to sustain the necessary response to protect our wild deer herd and our connection to these animals. On behalf of the New England and New York chapters of BHA, thank you so much for listening. We would really appreciate it if you're not already a member to join today. Your membership makes a huge difference in our ability to work on behalf of our wild public lands, waters, and wildlife. We'll talk soon.